The city is encouraging more people in Boston to be tested for COVID-19. To make sure that happens, community health centers are providing tests free of charge, partly with the goal of reaching more vulnerable populations. To tell us about efforts in the North End in Charlestown is the Chief Medical Officer for NEW Health, that's New Health, Dr. John Foster. Thank you very much for being with us, Doctor.
Yeah, thanks for having me on.
Doctor, when I think of the North End in Charlestown, I look at the numbers from the city, and the first thing that comes to my mind is, well, these areas don't have very high infection rates. They're in good shape, but when you look at them more closely, what do you see?
Well, I think they're two very different communities. In the North End, when our health center opened in 1971, was actually quite an underserved area of the city with mostly poor Italian immigrants. There was limited primary care and limited care, and when the Southeast Expressway was still there, which I know you remember for sure, the people in this community in the North End, to go to Mass General was like going to France. It seemed like a huge undertaking, and really primary care was really not. It was really getting off the ground. We were one of the early health centers in the country, and other than seeing private doctors in their offices, there really were just clinics in the hospital. You go and sat on a bench and got care. So I think in terms of this community, we have changed, obviously. It's gotten more affluent compared to its origins. So I think we'll get to that later, but our rate of infection is quite low in the North End. Now, if we move to our Charlestown site, it's right across the street from the Bunker Hill housing development, which I think is the largest public housing development in the state, and a clear underserved area of Boston, and it's has a higher rate than baseline of positive coronavirus tests. So I think you're exactly right that even looking at towns may miss sort of a finer granular view of parts of towns that actually have high risk and high prevalence. I know in Somerville recently, the mayor decided to kind of slow down getting to phase 2 and phase 3, and because they saw some increased cases. So I think absolutely right. It really depends on the community you're in, and the underserved communities are more at risk for coronavirus. There's no question.
How do you reach that underserved population? I mean, I imagine there are language barriers to consider as well, aren't there?
Yeah, well, one of the things about the community health center movement, as opposed to just private doctors' offices, is that the partnership with the federal government, which gives some grant funding, comes with the responsibility to really serve your community and what your community needs. So whereas a private physician's office doesn't have a mandate to see what languages are prevalent in your community and make sure you have translation services, for example, we do need to do that. So, for example, the site in Charlestown, pretty much everyone there speaks Spanish. We even have a Russian-speaking doctor, and there's some other languages also. Here in the North End, we have a lot of people that speak Italian, and we do have Spanish speaking here. So I think you can reach them that way. And the other thing that's really important is having healthcare accessible that doesn't require transportation. I think that's such an impediment to care, and that's why we had this site in Charlestown start about 5 years ago, directly across the street from the housing project. You can literally walk across Tuff Street from the buildings in the housing project and walk in and see your doctor. So you don't have to get on a bus, you don't have to have anyone drive you. And I think those are the two things important. But yeah, you need to be able to have translation services and accessibility, and then focus your programs on what people need. We have outreach workers. There are educational programs. We actually, before the coronavirus started, we had started a drop-in center at the health center in Charlestown where people could come in and get help with anything from making appointments to filling out forms for benefits, applying for Medicaid, things like that. So that's basically how we reach them. Yeah.
A lot of people want testing if they think they have COVID-19 symptoms, but this free testing is being recommended even for people who have no symptoms that they're aware of. Why is that?
Yeah, well, I wanted to kind of, I want to kind of correct that a little bit, that officially, it's not like everyone should get a flu shot. Actually, the official recommendation, if you go on the Department of Public Health website or talk to the leaders at the health at the hospital, for example, there isn't an ask for everyone to go get tested who's asymptomatic. However, there are asymptomatic patients that should be tested, and those are people that have had known contact with a positive patient, people who may be going into situations where there's a higher risk of infecting other people. So for example, a school starting or a workplace starting up might up front require all their workers to have a test. So, because if there's one or two people, then you're in a workplace, you could infect other people. But I think, the average person walking around who's feeling fine, has been following precautions, doesn't have any symptoms, hasn't contacted anyone, isn't about to go live with their sick grandmother who's on chemotherapy or something like that. We aren't recommending everyone just get tested, who are asymptomatic, even though they can. We aren't recommending it. Yeah. But there are a lot of asymptomatic people that could fall into those categories.
Testing not only helps the person who's being tested, you can also stop the spread to other people when you get the results quickly. So how quickly are you getting results from these tests?
Yeah, well, we've been fortunate in our testing sites to be partnered with Mass General, and they've been very gracious as a partner, helping us get tests and get the results done through their lab. And we have about a 1-day turnaround for results, which is really superb. I think, I know around the country and other commercial labs, it's been a real struggle with what's happened in the South and Southwest and Florida. Really a struggle having the capacity to get results out before, 3, 4, 5 days. I think, you really want to get the results as quickly as possible of someone, especially if they're symptomatic, so you can really, impress on them the importance of isolation and also start tracing contacts. 5 days later, you might kind of forget, who you were with 2 days ago or something like that. And so we've been very fortunate here. I don't know if the rest of Boston has had, as easy a turnaround, but we've been very lucky. Yeah.
One thing I see potential for, at least with the testing, is you engage more people with primary care, and that means you address minor problems before they become a crisis. Do you see this changing down the line, that this is going to be done more often, maybe?
I'm sorry.
In other words, by having more contact with people at the primary care level, and keeping an eye on things that might crop up. If it's a minor problem, you follow it instead of having people put it off until they have to go to the emergency room. Will there be more of that in the future, maybe?
Yeah, I think so. I think that, we've not only made more contact with people who may not have primary care because they're coming for tests, and we make a point to offer them to become new patients of our sites if they don't have a primary care doc. But I think there is, there'll be an easier avenues towards getting care. And I think a lot of people are learning, and we're telling them, don't wait till you're having severe respiratory problems before calling. If you, have a few days of symptoms, give a call. It's much better to get tested and get treated early. I think especially with the advent of telemedicine, which has really exploded now because insurance companies have started paying for it, we've actually been able to reach some people a lot easier through video visits. And that's another way people can have early intervention, whereas even just going to the office might seem like too much, or they don't want to do it or whatever. So yeah, I'm hopeful that there'll be some interesting positives coming out of this experience that we'll learn. Yeah.
Well, one of the other things you have to do is help people with other problems that can have an effect on your health, such as food insecurity. Are you doing some of that?
Yeah, we everyone that comes to our testing sites are asked if they have trouble buying enough food, and if they do, they're given a $15 gift card that can be used to purchase food. So yes, we're asking about that, and then again, through offering to be primary care site, we can then engage them in other things that they might need help with, like housing insecurity, getting on Medicaid, for example, so they can get health care. But yeah, the food insecurity is part of the program for everyone getting tested.
Well, we should mention a little bit of the information that's needed for people who might want to get tested, especially if they have to do something in advance. What should they be doing, and where can they find more details?
Well, I think for our testing sites, the testing is scheduled by appointment. You can imagine that this isn't sort of a situation where you want 50 people to line up at 10 o'clock for tests. So most testing sites have scheduled times that people would come in. So there's a little control of the volume so it can be very safe. For our sites in the North End and Charlestown, you need to call the main numbers and just ask, I want to set up a coronavirus test. And they will get someone back to you that will probably be a nurse that will follow an algorithm to ask you a bunch of questions and then put you in for scheduling for a test. I think the best thing for the public to know is the Department of Public Health website is superb in terms of testing sites in the state. So if you go to mass.gov/DPH, it's a good website. I've looked at it just yesterday, and they have a clear question asking people, what do you want? I want to get tested. You can click on a link that says that and find all the testing sites in the state. All the partners, actually they're now Mass General Brigham, all their urgent care sites are able to do testing as a walk-in. Many CVSs or other pharmacies have testing around the state, many other urgent care sites. So there's a very comprehensive list online there. But for our sites, you call the main number to make an appointment. We are restricted to people who live in our communities, so you may have to show proof of residency in the North End or in Charlestown, or be patients of our facilities. You can be a patient and live outside.